Hi there, I am Susie Devine. I am a women's health and fertility and IVF nurse. This is part 2 of our IVF series and understanding how it works. In this segment, we are going to cover the stimulation monitoring process and then the retrieval process, which is when we're going to harvest your eggs. All right, so you've probably already gone through the whole workup phase to get here. You've met with your reproductive endocrinologist and infertility specialist. You've completed your workup and you now have your IVF protocol and you are ready to go. If you haven't done this yet, I do suggest that you go back and watch our first video on how to prepare for IVF. You're now at the starting line. You're ready to start stimulation. You want to make sure that you have your medications at home. You will have received these from your fertility pharmacy, and your nurse or doctor will have already called these in for you. So before you have any appointments scheduled for IVF, you're already going to have all the medications you need at home. You should have already gone through a checklist of your medications and had injection training if you are taking stimulating injections with your IVF nurse. Some of you might be taking oral medications only, but you're still going to want to have a protocol and calendar for when you're supposed to be taking these medications. The first step in this process is the baseline appointment. This is a really exciting and extremely overwhelming day. Many of you have waited for months, maybe years to get to this point. You may have funded this yourself if you don't have IVF coverage. And so there's a lot riding on the IVF stimulation process because the hope is to get some healthy embryos and get you pregnant at the end of this process. The baseline ultrasound is when we're going to go in and look at your 2 ovaries, if you have 2 ovaries, and we're going to start measuring all of your antral follicles. These are those premature eggs that are hanging out on your ovaries at the beginning of every month or at the beginning of every menstrual cycle. We want to use this time to get an idea of how you might stimulate during your IVF stimulation process so that we can estimate how many eggs we think we might get during that egg retrieval. The second part of your baseline appointment is getting your blood work done. Trust me, I've been there. I know it really sucks, but having your blood drawn and your hormone levels measured is critical for how we're going to titrate your medication and get you to the retrieval process. This gives us an idea of how you're responding to your medication during this time. So at the baseline appointment, you're going to have a couple hormone levels drawn. You're going to have your estradiol level drawn. You're going to have your FSH level drawn. You're going to have a progesterone level drawn and a luteinizing hormone level drawn. Some physicians may add on additional hormones like a TSH level during this time, but that's discretionary and up to your physician. But those are really the basic hormones that we're going to be looking for before you start stimulation and during this whole process. Now you've made it through your baseline appointment. During the afternoon is when you're going to receive a callback for starting your first injections. This is a really exciting time, probably overwhelming, so get your partner involved if you have one, or there are a lot of nurses who will come to your home and do the injections for you. But make sure you have a plan for the medication injection process prior to your baseline appointment, because that night you don't want to be fumbling around or overwhelmed. And check back here because we have some exciting videos coming out for how to give yourself these injections. So you can always refer back to those here on YouTube. After the baseline appointment, you're going to start taking those medications. You're going to take them for a couple days before you go back into the office. This is called the monitoring phase of IVF. So you're going to be going in every morning, every other morning for that blood work and ultrasound. Sometimes it's an ultrasound, sometimes it's just blood work, sometimes it's both. This process happens for typically around 10 to 14 days. Obviously, that's the average person. There are people who fall a little bit shorter, and there are people whose cycles go a little bit longer. At the end of this process, what we're looking for is for you to have some mature looking eggs on your ovaries or follicles. These need to be measuring a specific size. We typically like around 18 to 20 millimeters in size on ultrasound. However, you can have a cohort that's a little bit smaller and still have a mature egg, and you can have ones that are larger and still have a mature egg. But that's the average cohort that they're going to be looking for on ultrasound. The other part of this are your hormone levels again. So if we know that your follicles are a certain size, we want to look and make sure that your estradiol level matches where your follicular growth is. If your estradiol level is a certain level and your progesterone isn't rising, then it's time for you to take your trigger shot. Okay, this is it. This is what you've been waiting for. This is the big night where you get the call from your team. They're going to give you a very specific time to take your trigger medication, and you have to listen to your medical team. There are no excuses. You have to take it at the time they give you, because this is going to determine your retrieval time in the OR, and we don't want to miss those eggs and have them ovulate. So really, really critical that you listen to your medical team. They're telling you this for a reason. Promise you. After trigger shot night, the next day you're just going to go in for blood work, confirm that the trigger shot worked, and then your retrieval will be the following day. So it's typically within like a 36-hour time frame is when you're going to be scheduled for your egg retrieval operation. When it comes to egg retrieval the night before, you want to make sure that you stop eating at midnight. So the only things that you can have are clear liquids. The next morning, when it's the actual operation morning, you can get up and brush your teeth, have a little bit of water, but that's it. You cannot eat. No, it's crummy, but it's to make sure that you're okay, because you are likely going to have some anesthetic medication to put you to sleep. When you get to your clinic, they're going to take you to the surgical center or the operation center of the clinic. Most clinics have this. If you typically go to a satellite office, then you're likely going to go to the main office. That's usually where the OR is. The nurse is going to check you in, you're going to put on a gown, and you are going to have an IV in your arm if you're not having local anesthesia. Then the anesthesiologist will come around, introduce himself or herself, and tell you what they're going to do. After that, you are going to meet with the embryologist, and the embryologist is going to walk through their role in the process. And then your doctor should come in and greet you, and then you are ready to go. So you'll be wheeled into the surgical area. Your legs will be in stirrups, kind of like they are in the office. The doctor is going to go into the vaginal canal, and from there, guided by ultrasound, they're going to go to each ovary. And at each ovary, they're going to use that hollow needle with a suction on the end to suck out every single follicle. And then whatever is inside goes through a catheter to those little Petri tubes that you would find in a lab. And then those get passed to the embryologist in the next room in the lab. And they go through with a microscope to identify if there is an egg that was collected from that follicle. So by the time you wake up and finish the retrieval process, you likely will know how many eggs were retrieved. We won't know how many eggs are mature until the next day. So overnight is when the fertilization process happens. You're either doing conventional or ICSI. If you don't know what those two things are, I suggest you go back and watch our How to Prepare for IVF video, where we go through the two options for fertilization. Over the next couple of days, you're going to be getting a call from either the embryology team or your IVF nurse or coordinator or your physician with embryo updates. This is probably the most anxiety-provoking part of the whole process. This is really what you've been waiting for, and those embryos really count, every single one. So it can be really hard to process if you're getting bad news. Remember, it often takes just one embryo, but sometimes you don't get one. So make sure you've gone over with your doctor what you expect to get out of your IVF cycle before you start. This way you can be prepared for good and bad news that comes after the egg retrieval. So that's it. That's the basics of the IVF stimulation monitoring process and your cheat sheet on the retrieval. In the next video, we're going to go through the whole transfer process and then what to do if things go right or wrong. So please stay tuned. Make sure you subscribe to our channel to get the latest updates on all of our videos that come out. Again, I am Susie Devine, and you can find us at mybinto.com. And there you'll find a community of other women who are going through the same fertility process as you.